is apropos. Well, she's one of at least 3 Senate-confirmed regulatory officials the Trump administration has moved to fire in recent days, but her lawyers say she's going nowhere. After less than a month in the role, the White House says it's removed Susan Monarez from her position as director of the Centers for Disease Control and Prevention following clashes with Health Secretary Robert F. Kennedy Jr. over his controversial vaccine policy. Monty Francis has the details.
At the dawn of the genomics era,
she was nominated by Donald Trump himself, but after less than a month on the job, the White House says that Susan Monarez has been fired as head of the CDC. In a statement, the administration explained that Monarez was not aligned with the president's agenda of making America healthy again. The nation's top health official, Robert F. Kennedy, would only say this about the firing during an appearance on Fox News.
But the agency is in trouble, and we need to fix it. And we are fixing it, and it may be that some people should not be working there anymore.
So if I'm confirmed as a CDC director...
Monarez, who testified before the Senate in June, says she was pressured by Kennedy, a vaccine skeptic, to change the agency's vaccine policy. She initially refused to step down, and through her lawyers, she accused Kennedy of weaponizing public health for political gain and putting millions of American lives at risk.
When CDC Director Susan Monarez refused to rubber stamp unscientific, reckless directives and fire dedicated health experts, she chose protecting the public over serving a political agenda. For that reason, she has been targeted.
As the nation's top health official, Kennedy has effectively done away with an advisory committee that recommends vaccines and revived a task force to scrutinize childhood vaccines, prompting concern from most health experts. In response to Monarez's firing, several other top officials at the CDC resigned, including the agency's chief medical officer. And all of this follows months of turmoil at the CDC. Its budget has been slashed, hundreds of employees terminated, and the agency is still reeling after a gunman fired hundreds of rounds at the CDC headquarters in Atlanta earlier this month, apparently upset about the effects he claims to have suffered as a result of a COVID vaccine.
To discuss, let's bring in Lawrence Gostin, Director of the WHO Collaborating Centre on National and Global Health Law. Lawrence, thanks for being with us on the programme this evening. As we say, she is one of at least 3 Senate-confirmed regulatory officials that Donald Trump has moved against in recent days. She hasn't even been in the job a month. In your view, why exactly is Susan Monarez being targeted?
Well, let's be clear why she's being targeted. It isn't because she's had any malfeasance or corruption. She's being targeted precisely because she's doing her job. She's relying on science and scientific evidence to make vaccine and other public health policy, which she is charged with doing. And what she's refusing to do is to be obedient to a political orthodoxy. There's no RFK or Trump science. There's only science. And there is no political agenda about science. There's only a desire to use the best possible evidence to keep Americans healthy and safe. That's what she did. That's not a fireable offense.
And in terms of fireable offences and even the right to fire her, is it only Donald Trump rather than White House officials who have the power to remove a CDC director? That's what her lawyers are claiming.
Yes, as a matter of law, that's true. For many decades, the Secretary for Health and Human Services had the constitutional power to fire the director of CDC. But recently, Congress passed a law requiring Senate confirmation for CDC director. She's the first one to ever be a Senate-confirmed nominee. And for that, you need the president. Now, the president has been conspicuously silent, eerily silent on this, but the White House has said that the president signed off on it. He does have the power, but Secretary Kennedy doesn't. But even if he does have the power, this is bad for the American population. I've worked with the CDC for over 40 years in Republican and Democratic administrations, and I've never seen anything like this. The undermining, the denigrating of career public servants and scientists and CDC leadership. This is a very dangerous moment for the United States.
Yeah, and lawyers for the CDC director, they're saying this is all part of a systematic dismantling of public health institutions, silencing of experts, and the dangerous politicization of science. Where is all of this headed?
I think it's headed in a very bad direction. You mentioned at the start of the show that Robert F. Kennedy Jr. fired all 12 members of the CDC's Advisory Committee on Immunization Practices. These are the top scientists. And what he did was he replaced them with loyalists, yes men, and anti-vaccine skeptics. Now, if you think about it, that's exactly what he's going to do at CDC. He's going to replace Susan Monarez and other CDC senior leadership and senior scientists with people that have blind fidelity to a political ideology, unmoored from science and public health. And that will cost lives in the United States, undoubtedly.
And it could also have a big impact outside the United States as well. Lawrence, remind us, what other changes has the Health Secretary made when it comes to vaccine policies since taking office, and have those changes had any impact yet?
Oh, it's been a systematic assault on vaccinations. This includes, as I mentioned, the firing of all senior scientific advisors on vaccination and replacing them wholesale, removing research for messenger RNA vaccines, which has saved millions of lives during COVID, but also could be used for cancer and other infectious diseases and future public health emergencies. He's tried to amplify and study the links between autism and measles vaccines, and no link exists, just stepping up hysteria. And he's also threatened to impose steep liability on vaccine makers, which will make them leave the field. I could go on, but this is literally a systematic assault on science, public health, and vaccinations in particular. And the CDC itself called vaccines the greatest public health achievement of the 20th century, and all of us in science agree.
And it's not long, of course, since a gunman attacked the CDC's Atlanta headquarters. It's also seen staff numbers cut, it's seen funding cut. How concerned are people there at the moment about what the future is for the centre?
I've been in touch with my friends at CDC. I've never seen them with such low morale, so dispirited, feeling so alone and isolated, and even they feel like they're distrusted and almost disliked by the administration and by the general public because they've fomented distrust against them. Now, I'm not going to say that Secretary Kennedy is responsible for the shooting at the CDC headquarters, but I do think there's a direct line between all of the venom that he spewed out against scientists, public health officials, and CDC in particular, and what happened in Atlanta. We're at the most dangerous moment that I've seen for science in America. There's a reason why countries around the world, including in Europe, call their public agencies the CDC, because they're the gold standard in science and public health. And when the next pandemic hits, we'll knock on the CDC's door for help, and no one will be there.
And Lawrence, just finally, how far do you think Donald Trump will go in wresting control over agencies in the US that have traditionally been independent of presidential politics? This all coming ahead of what's shaping up to be a legal showdown with Lisa Cook at the Federal Reserve.
Yeah, you know, it's becoming really clear what Donald Trump is doing. He's doing everything that he can to undermine the federal workforce, federal agencies, experts in economics, public health, science, environmental protection, and you name it. And what's happening is he'll do whatever he wants, whether it's constitutional or not, unless and until somebody stops him. And we have a completely compliant Congress that will do nothing to stop him, even though he's usurping their powers. And we have a very compliant Supreme Court that's stacked with hyper conservatives that seem to think that their job is to defend the president, including giving him immunity for whatever he does. So he will keep doing it until he's stopped. And he has to be stopped for the sake of American health, security, integrity, and our reputation all around the world.
Lawrence, we'll have to leave it on
I
that.
don't recognize the America that I see right now.
Well, we'll have to leave it on that note, Lawrence. Thanks so much for being with us on the programme this evening. That is Lawrence Gostin, Director of the WHO Collaborating Centre on National and Global Health Law. Thank you.